He's the next patient. Follow up. उम्र कितना है? 27. He's 27. He had been diagnosed with a pancreatic cyst in 2020. Pancreatic cyst in 2020. He was operated for that. Operation कब हुआ था? नवंबर में. हाँ? November 2020. But he had been having recurrence of pancreatic pain. Recurrence of pancreatic pain. पहले दर्द कहाँ पे होता था? उठ के दिखाओ थोड़ा. फिर
पीछे साइड जाता था, फिर इधर से नीचे आता था.
लेफ्ट एब्डोमिनल पेन उस साइड में जाके दिखाओ. बीच में. हाँ, लेफ्ट दिखाओ कहाँ पे? Left abdominal pain which used to radiate downwards, go to the back as well. But कैसे कम होता था?
जैसे लेट जाते थे ऐसे करके पूरा.
Used to do like this. दिखाओ.
ऐसे करके पूरा लेट.
Which used to make him better initially, right? There was nausea better. There was nausea along with it. So even though he got operated in November 2020, these episodes of pain continued recurrently over time. There was sour vomiting as well, and each time he needed to be admitted to the hospital because it was quite severe episodes of pain. Injection देना पड़ता था. That was his major presenting complaint. Frequent weight loss. Gradual weight loss over time due to the recurrent episodes of the pain. Is of a mild temperament, fear of being alone. That was about it in the case, to be honest. He had got the surgery in 2020, and with pancreatic pain, the amylase and the lipase levels rises. Last report hai? The MRCP shows residual changes of pancreatitis with multiple fluid collection. His gallbladder was also removed in 2020. So cholecystectomy was also done. Gallbladder हटा दिया था तो stone था तो उस time पे. He is not sure if there were stones or not, but they removed it. You don't need it, just sort of. I'll pass on his reports initially. Have a look. दर्द पहले से कम है?
हाँ सर, अभी पहले से 90 बराबर.
Pain has not been there at all. We have been seeing him since March 2023, so 2 years almost. दर्द अभी कितने दिन से कम है? 1 year he hasn't had any episodes of pain. We had started the case initially with colocynth, left-sided, better by pressure, right? You saw exactly. फिर से दिखाओ, those who didn't see, have a look. That was the exact location of the pain. वहाँ से कहाँ तक जाता था? Goes to the back, goes downwards. कैसे करने से कम होता था? Better by pressure. Colocynth 200 was given, 1M was given. Pain was better, but there were still recurrences which was coming. There were still recurrences. October 2023, we changed the plan of treatment to Pancreatinum. Remember, this is very typical for Pancreatinum, and with pancreatitis, the name of the remedy is better. Pancreatinum. With Pancreatinum, recurrent episodes of pancreatic pain. Your constitution, it's a sarcode, right? It's your constitutional remedy has helped, the pain is better, but there's still recurrences. So maybe the intensity, the frequency is less, but it's still recurring. Use Pancreatinum to break that cycle. Then lots of good cases where there is pancreatitis and it is recurring. A constitutional remedy has helped, but it's not being able to break that cycle of recurrence. And with pancreatitis, you will find very often, there is a tendency for pain to come back. So use pancreatinum A. B, not with his case, but you will find many cases of diabetes mellitus which has started post pancreatitis. Start with pancreatinum in those cases. I repeat, diabetes mellitus which has started post pancreatitis. Start with pancreatinum in such cases, and that will also give you good results. Start with a 30, 200, 1M, go higher up the scale, and then move on to a constitutional remedy after that. So although colocynth helped, but you have to understand again, I have shared with you in the past also last week, that you have to assess what is the depth of the remedy. Okay, colocynth is a good acting remedy, it can help cure many cases, but it may not always have the depth to finish a case. And there you need a deeper acting remedy, where you see pancreatinum was prescribed in October or November of 2023. 2024 it was absolutely painless. Hasn't been single, last exhale se to pain nahi aaya hai. There has been no episode of pain at all. But he's suffering in the past, he's still willing to continue the medication for some time, so that there is no further chances of relapse.
The highest
We had started in this case with 30C of pancreatinum, and gradually we have, last prescription was pancreatinum, like 30C twice, 200C twice. Last prescription of pancreatinum was November 1M. Okay. No bloating. Abhi takleef hai kuch aisa? No complaints as such, but we are still continuing the treatment. I will at least continue for 6 to 8 months more before leaving him.
With these nosomes, do you go up to 50M all the way?
Like he's so much better with it, I will gradually
Carry
go
on
higher.
As a normal remedy, yeah.
Yeah.
Yeah, no difference between
No,
the nosome.
no.
Okay. Well, this type of
Pancreatinum is a sarcode though, but
Sarcode,
still
yeah.
it's absolutely fine.
Yeah.
दर्द दिखाओ कहाँ पे होता था? This exact location, if the pathology was a liver pathology, right? Have a look in Borike, carduus marinus. Carduus marinus. Liver, remember, is mostly a right-sided pain. But whenever a patient with a liver gallbladder pathology tells you that my pain is here, remember it is always carduus marinus. Have a look in Borike, please. Carduus, CARDWS. With a liver, better. With a liver gallbladder pathology. St. Mary's thistle. Action of this drug is centered in the liver and portal system. CARDWS, carduus. Center of this drug is centered in the liver. Look in the abdomen section. Pain in the region of the liver, left lobe very sensitive. So left-sided pains with a liver pathology. Remember, commonly liver pathology pain will be right-sided. Chelidonium has that. But whenever a liver gallbladder ailment and the patient shows you it's predominantly left-sided, try carduus. That's a PQRS, in terms of the sphere of action, right? Left lobe very sensitive. You can have jaundice, cirrhosis. Other symptoms are, just an additional. This has to be there for a carduus prescription. It has to be a left-sided abdominal pain. You can have jaundice, you can have low appetite. If you see the stomach section, third line, stitches in left side of the stomach near spleen. But it's not a splenic remedy. It's a liver remedy, but the pain is left-sided. Right? So that's about your carduus. Last prescription was 1M in November. There's no reason for any repetition. We are boosting still. Carduus is prescribed. You can prescribe it in C scale 30 to 100, even as an organopathic tincture also.
Any current program?
No, nothing at all. But I've asked him to continue treatment for some time so that we can be actually sure.
During when you change it, when you repeat 30 or 20, what if the
He was having some degree of other symptoms, like there was bloating, there was little bit of constipation was there, and he was saying I was losing weight. Weight has been static for the last few months, so it has not fallen down. That's why we are waiting. In between, he was having some burning in his palm and soles, which was gone with pancreatinum as well. So there was no pain in the last year, but there were some gastric issues, bloating was there, which pancreatinum has taken care of as well. ठीक है, नीचे दे देगा. Thank you.
Sorry to ask you again, why 30 and not 100?
भेज दे. For pancreatinum, to start with, it's more of a physical ailment. There's no emotional factor to it, and that's why 30C is better to start with, although it's a sarcoma.